Top Med Talk.
Nick Majerison here, welcome to Top Med Talk, and this is a conference highlight. It features Joff Lacey speaking with Dr. Mark Edwards, consultant in anaesthesia and perioperative medicine at the University Hospital Southampton, and Professor Gerard Danjoux, consultant in anaesthesia and sleep medicine at South Tees Hospital's NHS Foundation Trust. They're talking about exercise and its anti-inflammatory effects at Anaesthesia 2018, the international meeting of the Royal College of Anaesthetists at the British Museum. Have a listen.
A lot of our unhealthy lifestyle behaviours, if you like, are thought to lead to this state of chronic inflammation, which the end product is kind of disease, chronic health conditions. And interestingly, some of the more recent thoughts around exercise is that it is an anti-inflammatory. So you can see where that might come from.
Yeah,
well, just to kind of fill in some of the gaps there, Mark, if you could explain, you showed a very interesting slide on that where which showed the gene transcription for those patients that suffered complications, those that didn't, and how it changed throughout their perioperative pathway.
Sure, yeah. So that was an interesting study by Zhao in the Journal of Experimental Medicine, and it was really, this is less about, I guess, the pre-insult phenotype and more about what is the systemic response to a kind of a tissue injury. They looked at a mixture of insults like burns or severe blunt trauma. And what they saw really, they looked at gene transcription patterns across within leukocytes, and it was really dramatic that the changes that happen, almost 80% of gene transcription changes in response to those kind of insults. And interestingly, even though conventionally, I guess, within critical illness we've seen or we've heard about the SIRS response, systemic inflammatory response syndrome, it's big peak of inflammation, which can be life-threatening itself, which then wanes away and then is followed by a sort of system of immune suppression, which then makes people much more susceptible to kind of low-level pathogens, and that's how they get this kind of second hit and so on. They were challenging that model. They said, look, actually we can see these changes happening simultaneously. So we get changes which would lead to a state of relatively suppressed immune cell function at the same time as we're seeing this kind of pro-inflammatory burst as well. So the whole kind of spectrum is changing. But that actually the pattern in which that happens seems really kind of stereotyped. So across types of insult, that seems to be a consistent pattern. And it also, the actual pattern of it appeared similar between patients who had an uneventful recovery from that insult as compared with patients who had a much more difficult time, had complications, and had poor clinical outcomes. The pattern of change was very similar. What was different was the magnitude of change was much greater in the sort of the disordered patients with complications, and also the duration was much longer, and they could still see gene transcription changes 28 days after the original insult in patients with with a complicated recovery from that.
That's interesting, because if you look at how that maps against the slide I put up as to how prehabilitation is kind of designed to increase your buffer, if you like, of activity independency leading up to surgery, and this melee of things that go on around the time of the surgical insult cause the drop in independency and then the recovery period. So that fits in really nicely with that kind of model that we also see in frailty, for example, in people who just get a flu insult or something. It's a very similar translatable model. It's just the insult here happens to be surgery.
So it's not just the say obvious benefits, the cardiorespiratory benefits of exercise. Is actually placing the patient in the optimal inflammatory state preoperatively, so that they don't get as much response as possible. I mean,
we don't have that level of evidence. That's the theory. But that is exactly where we're coming from. That addressing these unhealthy lifestyle behaviours, optimising chronic health, is going to have its own anti-inflammatory effect leading up to surgery, as well as other hopefully longer-term benefits from a public health perspective. So,
I mean, I think that persistent inflammation thing after surgery might be a real, plausible explanation for why we see in hospital morbidity mapping so well to long-term mortality, long-term illness. There's this thing that I showed about people being much more prone to deep vein thrombosis for weeks and months after even quite minor surgery. So what's going on there? What's been set in motion? And again, I mean, there could be other mechanisms. It's a theory. It's hypothesis generating, but it's quite plausible that actually there's a degree of chronic inflammation there which is driving ongoing processes. And if you don't have the reserve to kind of deal with those, perhaps you then get into a vicious cycle around reduced activity, more of a sort of an unhelpful physiological status, and that kind of catches up with you.
Top Med Talk.
Don't forget to check out topmedtalk.com for both the longer conversation and some of the other conversations that were had at Anaesthesia 2018, the international meeting of the Royal College of Anaesthetists at the British Museum in London, England.